Hello, my name is June Anonson. I'm a professor at the College of Nursing, and I'm delighted to be here with Donna Brooks. I'm working on a group called Pathways to Equity that are working on research and looking at working together with community on a population that's currently homeless. Today, we're meeting as part of the original Spotlight video series, and we're going to be introducing Donna Brooks. I'll ask Donna some questions and hope this is helpful for you. Hope you enjoy it. Donna, can you tell us about the work you currently do and how it's connected to issues of housing insecurity and homelessness? And introduce yourself first, please.
Sure. I'm Donna Brooks. I'm the Chief Executive Officer at the YWCA in Prince Albert. We have a number of programs within our organization that works with people on all levels of the housing continuum. And with the housing continuum, you can have absolute homeless, somebody's on the street, as the lowest part on the housing continuum, and the highest part on the housing continuum is actually owning your own home. So that's the housing continuum. We don't work with that many people that own their own home. They don't usually need our services if they own their own home. But a great deal of people that we do work with are hard to house and have been homeless and episodically and chronically homeless. We operate a number of shelters as well as supportive housing for a large number of different client groups. And our goal is to make people as self-sufficient as we can, is to empower them to be self-sufficient.
Okay. Thank you, Donna. So you talked a little bit about your services. Was there any other services or programs that you provide that you'd like to mention?
Well, we will provide a lot of programs. So we also do refugee and immigrant settlements. We do community connection. We do employment. We do youth programs. We do training, in addition to anything related to housing and homelessness.
Can you tell us a little bit about some of the challenges that you face in this work?
Well, I think and things change, like housing and homelessness evolve and the needs evolve over the years. But I think the biggest challenge that we have faced is probably getting the Ministry of Social Services on the income support side of things to recognize the need that there is a complex group of people that are hard to house, that have mental health issues and addictions issues, and they don't necessarily fit their one-size-fits-all policy framework. So those people fall through the cracks. They fall through the cracks for a variety of reasons because they don't fit that framework.
Also, can you just explain or tell us a little bit about some of the successes you've seen in this area?
So some of the successes we've seen is where we have actually taken clients that are absolutely homeless. They come into our shelter, and then we're able to help them move up the continuum. So they might go from the overnight shelter to a 24-hour shelter, from the 24-hour shelter to our Housing First program, where they receive their wraparound supports. Then we've had clients that are actually able to graduate from that program and then become employees. And by becoming employees, then they're able to help the cycle, help the people who are facing homelessness. So those are success stories when we see that. But also sometimes there are little success stories. So we might have a client who's chronically been on the street, who suffers from mental health addictions issues and cognitive issues, but we are able to put the supports around them so that they are in supportive housing, a harm reduction model of supportive housing. So they're not sleeping on the street every night and putting strain on the emergency services like the police and ambulance. So those are success stories too. There's big ones and there's small ones, but also every person we're able to get off the street is a success story.
Absolutely. Thank you, Donna, for that. The next question, I'm just wondering, from your experience, what do you wish that people understood better about housing insecurity and homelessness?
I wish that people understood that it's not always a matter of choice. A lot of the general public think people choose this lifestyle, that this is what they choose. And you know what? In some cases, some clients will say, no, I don't want to go to a shelter. I'd rather be on the street. But are they really choosing that, or is it because of intergenerational trauma? Is it because of something in their past? Is it, if the average person doesn't just wake up one day and decide, I'm going to go live in a tent downtown. It's not a choice like people think it's a choice. Sometimes people are born with the deck stacked against them, and they don't have the same choices presented to them to even make a choice. And sometimes that choice isn't there. If there's no apartment to rent, you have no rental references, you cognitively don't understand how to even do it, you suffer from addictions, there's so many different issues that the choices aren't necessarily there. And that's what people have difficulty understanding is that side of it.
You've mentioned mental health and addictions. Can you tell us, is there a single issue that's impacting people in your community the most? And if yes, what is it?
Well, in prior years, it's usually been alcoholism. That's been the main driver to homelessness. But now we're seeing a new a group of people with crystal meth addictions, and crystal meth is almost impossible to house. Almost even in the shelters, like they're just extremely difficult to house. And that we are seeing that in our community and northern communities too. I have talked to people from northern communities that are seeing the same thing.
And why are they difficult to house?
Just because the way crystal meth works with people, they become very volatile. They can become aggressive. It makes it extremely difficult, but they seem to not last in the programs. Crystal meth just seems to take it to another level. I don't have a degree or anything addiction, so I don't really know why that is. I just know that it is, and it's having an impact.
Wow. Donna, when you think about services, policies, and programs, so services, policies, and programs, where do you see the biggest gaps?
The Ministry of Social Services is their legislation and their policy is such that they have to, and this is just the income support side. This is not the child and family side. The child and family side it works well, but the income support side, they have to tie their funding to an individual. So if they can't tie to an individual, they can't fund that person in a shelter. So what they expect is that if they're going to fund a shelter, that the individual go to the shelter, and that individual needs to apply for social services, or they need to be eligible for social services for one. Then they need to apply for social services, which means walking to the social services office or calling social services on the 1-800 number, which is a very long wait. And they don't even have time to call that from the shelter, because the overnight shelter will be closed by then. And only then they become eligible. If they're approved, then they become eligible for housing in that shelter. We don't operate our shelters that way. We operate our shelter that anybody that's in need can come. However, it doesn't allow us to have, there's only so much money, and it doesn't allow us to have enough beds to be able to do that. But we're not going to turn someone away because they won't apply for social services. Like some of the clients that end up in the overnight shelter, they don't even, you have a hard time getting them to go across the street. There's a lot of issues and barriers they're facing. So that's the biggest barrier, is the legislation around how income support, the welfare, the social services system in this province is laid out.
Donna, this is very helpful to inform us about what's going on. And I think for our very last question, and what I'd like to ask is, what do you want researchers to know? What do you want researchers to know about housing insecurity in your community?
I want researchers to know that if we're going to address homelessness properly in our province, that we need to have the agencies working with those who are homeless need to have the proper funding in place to be able to do that. I guess that's because people will fall through the cracks. You can only do what you can do.
Yeah.
There also has, it's a hard one because homelessness is a really super complex issue, but you can't get people housed if the rent isn't high enough on the social services or the SED checks. You can't house people. You can't house people if they're not paying that rent directly to the landlord in with that client group. You can't house people because if the average rent out there is like 800 and they'll only give 500, well, what do you do? So there's got to be it's got to be a living amount that people can actually survive off of. And I also think there has to be more done in the area of mental health and addictions, because that drives it as well.
Yeah. Donna, are there any questions, ideas, or concerns that you have that you'd like a research team to address?
No, my biggest concern is the funding models, is the shelter funding models.
Yeah.
That's my absolute biggest concern, is that, and the income support, the way income support is handed out, so to speak.
Okay. Please join us November 19th. That's not this Friday, next Friday, for the Pathways to Equity workshops. The topics are housing insecurity, renter equity, and homelessness.